Gentlemen, when we talk about keeping your penis healthy after 60, we have to start where it all begins, with blood flow. Your erections are quite literally hydraulic events. No matter how healthy your testosterone levels are or how sharp your mind is, without proper circulation, firmness suffers. The reality is, as we age, arteries lose elasticity, the inner lining can get inflamed, and plaque can quietly build up. This isn't just a heart problem. Your penis has some of the smallest blood vessels in your body, so it's often the first place you notice reduced blood flow. The good news, even after 60, you can dramatically improve circulation with daily habits, walking briskly for 20 to 30 minutes, cycling, light resistance training. All of these open up your arteries, boost nitric oxide, and keep that penile tissue fed with oxygen-rich blood. Deep breathing and stretching exercises, especially in the hips and pelvic area, encourage fresh circulation right where you need it most. You don't have to run marathons. Consistency is more important than intensity at this stage of life. One of the most overlooked secrets is targeted stretching for the groin and inner thigh muscles. These muscles, when tense, can slightly compress blood vessels, limiting flow. Loosening them opens up space for better expansion during arousal. Gentle squats, leg swings, and slow hip rotations daily can make a bigger difference than most men realize. Case study: a gentleman named Thomas, 67, came to me frustrated. His desire was strong, but he noticed his erections weren't as reliable. He wasn't on any medication that explained it. When we measured his vascular health, we saw reduced flow in his lower extremities. I put him on a daily 25-minute walking routine, added hip stretches, and encouraged him to take the stairs instead of the elevator. In just 6 weeks, his nighttime erections returned more frequently. By 3 months, he reported firmer, fuller erections during intimacy, without changing anything else in his life. Testosterone isn't just about libido. It's about tissue repair, mood, confidence, and even the quality of your erections. After 60, men's testosterone production naturally declines, but the speed of that decline is highly influenced by lifestyle. Poor sleep, belly fat, chronic stress, and alcohol excess all accelerate the drop. The easiest natural boost starts with strength training. Lifting weights, even light to moderate, signals your body to keep producing testosterone. Pair that with adequate protein, healthy fats from olive oil, nuts, and fatty fish, and you give your body the raw materials it needs. Another surprisingly powerful tool, sunlight. Just 15 minutes of morning sun helps regulate hormones and boosts vitamin D, which is strongly linked to testosterone production. Stress management is equally critical. Elevated cortisol, the stress hormone, directly suppresses testosterone. Breathing exercises, meditation, or even light gardening can bring cortisol back down. And remember, alcohol in moderation. More than 2 drinks a day will sabotage your hormonal balance over time. I worked with a retired engineer, Martin, age 71. His blood test showed low testosterone, but he didn't want hormone replacement. We set up a twice-a-week strength training routine, using resistance bands and light dumbbells, encouraged morning sunlight exposure, and cut his nightly wine from 3 glasses to 1. 3 months later, his free testosterone levels had risen 18%. His energy was higher, his mood was better, and he told me with a smile that his wife had noticed the difference too. Most men think pelvic floor exercises are only for women, but that's a myth. Your pelvic floor muscles wrap around the base of your penis and help control erections and ejaculation. Weakness here means less rigidity and poorer control during intimacy. To strengthen these muscles, I teach my patients the male version of Kegels. Contract the muscles you'd use to stop urination midstream. Hold for 3 seconds. Release for 3 seconds. Repeat 10 to 15 times, twice daily. Over weeks, this leads to better erection firmness and longer endurance. Adding a bit of core strengthening, like gentle planks or bird dog exercises, supports the pelvic floor even further. Harold, 65, had been married for 40 years, but found himself finishing too quickly during intimacy. He'd never heard of pelvic floor training. I had him start with simple 3-second contractions while brushing his teeth each morning and evening. Within 2 months, he reported lasting longer and having more control. And for the first time in years, he felt confident initiating intimacy without anxiety. After 60, skin becomes thinner and more prone to irritation. The penis is no exception. Daily hygiene is important, but so is gentleness. Harsh soaps strip away natural oils and can cause micro-irritations. I always recommend a mild, fragrance-free cleanser and warm, not hot, water. Drying thoroughly, especially under the foreskin, if uncircumcised, prevents moisture buildup that could lead to fungal infections. Moisturizing with a gentle, hypoallergenic lotion can help prevent dryness and cracking, especially in men living in dry climates. Avoid petroleum jelly for daily use, as it can trap bacteria if not cleaned off properly. Robert, 73, came to me complaining of persistent itching and redness. He had been using an antibacterial soap twice a day, thinking it was keeping things clean. In reality, it was stripping his skin's protective barrier. I switched him to a mild cleanser, advised once-a-day washing, and suggested a light moisturizer. Within a week, the irritation cleared, and he told me intimacy was more comfortable again. Sleep is not just about feeling rested. It's a hormonal factory reset for your body. Deep sleep cycles are when testosterone production peaks. Men over 60 often struggle with interrupted sleep, whether from prostate issues, sleep apnea, or simply lighter sleep patterns with age. But poor sleep doesn't just make you tired. It can directly shrink your sexual desire and weaken your erections. The goal should be 7 to 8 hours of quality rest, with at least 90 minutes of deep sleep. A consistent bedtime is key. Your hormones thrive on routine. Avoiding caffeine after 2 p.m., keeping your bedroom cool and dark, and reducing screen time in the hour before bed can all help restore deeper rest. A powerful little-known trick is a short evening stretching or breathing routine. By spending just 5 minutes in slow, deep breathing, with your exhale slightly longer than your inhale, you signal your nervous system to relax. This not only promotes better sleep, but also supports optimal nighttime testosterone release. Leonard, 69, had been waking up 3 to 4 times a night, leaving him drained during the day and uninterested in intimacy. We identified late-night news, watching as a stress trigger, replaced it with a quiet reading ritual, and added 10 minutes of gentle hip stretches before bed. Within 3 weeks, he was sleeping 6 to 7 hours uninterrupted. 2 months later, he reported feeling like the switch had turned back on in the bedroom. Your penis is a vascular organ, so nutrients that support blood vessels and nerve health can make a remarkable difference. Omega-3 fatty acids from fish or flax seeds keep arteries flexible. Magnesium, found in leafy greens and almonds, helps blood vessels relax. Zinc is vital for testosterone production and sperm health, while L-arginine, an amino acid found in turkey, chicken, and legumes, boosts nitric oxide levels, the chemical that makes erections possible. Vitamin D is another quiet hero. Low vitamin D has been linked to erectile dysfunction, especially in older men. If you can't get enough sun exposure, a high-quality supplement can help maintain healthy levels. Hydration is also often overlooked. Blood is mostly water, and even mild dehydration can reduce circulation efficiency. Aim for steady water intake throughout the day rather than gulping large amounts at once. Philip, 72, loved his coffee but rarely drank plain water. He also skipped vegetables most days. After running some tests, we found his magnesium and vitamin D were low. We added a daily magnesium supplement, encouraged 2 servings of leafy greens, and had him carry a water bottle. In just 1 month, his morning erections returned, and he felt more alert during the day. Many prescription medications, especially for blood pressure, depression, and enlarged prostate, can affect erections. The challenge is, men often assume this is just old age, not realizing their pill bottle might be contributing. If you notice a decline in sexual function after starting a new medication, never stop it suddenly, but do talk to your doctor. Sometimes an alternative drug or adjusted dosage can improve sexual performance without sacrificing your health. Certain lifestyle changes, like increasing exercise, improving diet, and reducing alcohol, can also offset side effects. In some cases, adding specific supplements under medical guidance can counteract the problem. George, 66, began a new blood pressure medication and noticed within 2 weeks his erections were weaker. His doctor switched him to a different class of medication, and we added a light walking routine to further help his blood pressure. Within a month, his sexual performance returned, and his blood pressure was still well controlled. Keeping the prostate healthy. The prostate plays a major role in sexual health, especially in men over 60. An enlarged prostate can press against the urethra, affecting both urination and ejaculation. While some degree of enlargement is common with age, symptoms like weak urine flow, frequent nighttime urination, or discomfort during intimacy are worth addressing. Foods like tomatoes, rich in lycopene, pumpkin seeds, rich in zinc, and cruciferous vegetables like broccoli may support prostate health. Staying sexually active, whether through intercourse or masturbation, also helps keep prostate fluid moving, which can reduce stagnation. Pelvic floor exercises can further support the prostate and improve urinary control. Walter, 70, had been waking to urinate 3 times a night and found intercourse less satisfying. His doctor confirmed mild prostate enlargement. We added tomato-based dishes twice a week, pumpkin seeds as a snack, and a daily set of pelvic floor exercises. Within 3 months, he was sleeping through most nights, and his intimacy felt more pleasurable again. Even with perfect physical health, anxiety can sabotage erections. Worrying about performance creates a stress loop. The more you think about it, the harder it becomes to achieve or maintain an erection. This is especially common in men who have experienced 1 or 2 off nights and start expecting it to happen again. Mindfulness, relaxation techniques, and open communication with a partner can help break this cycle. Sometimes scheduling intimacy for times when you feel most relaxed, such as after a weekend breakfast, can improve performance. Physical touch outside of intercourse, like massages or slow dancing, can also rebuild connection without pressure. Alan, 64, had one instance where he couldn't maintain an erection, and from then on, he became anxious every time intimacy was initiated. I had him practice a 5-minute daily breathing meditation, encouraged him to avoid alcohol before intimacy, and suggested he and his wife focus on non-penetrative touch for 2 weeks. By removing the pressure, his body naturally responded again, and his confidence returned. Boosting circulation through targeted exercises. Blood flow is the foundation of erectile strength. Without healthy circulation, even the best hormones can't do their job. As men age, the arteries naturally lose some elasticity, but lifestyle choices can either speed up or slow this process dramatically. Regular exercise keeps the cardiovascular system healthy, but for sexual performance, certain targeted movements can make a noticeable difference. Resistance training, such as squats, lunges, and deadlifts, increases testosterone and stimulates blood flow to the pelvic area. Aerobic activity, brisk walking, swimming, or cycling, improves the efficiency of your heart and blood vessels. A lesser-known secret is pelvic floor training for men. Strengthening the muscles that support the penis and bladder improves both erection firmness and control over ejaculation. These exercises involve tightening and holding the muscles you'd use to stop urine midstream. Frank, 68, had no trouble getting aroused mentally, but noticed his erections didn't last as long as they used to. We added 2 short 15-minute strength workouts per week and a daily pelvic floor routine. Within 6 weeks, his erections were firmer and lasted significantly longer, making intimacy far more satisfying for both him and his wife. Testosterone isn't just about libido. It affects mood, muscle mass, energy levels, and bone density. After age 30, testosterone gradually declines, but the rate and impact vary greatly from man to man. Low testosterone can lead to reduced sexual desire, difficulty achieving erections, increased body fat, and decreased motivation. Natural ways to support testosterone include regular resistance training, maintaining a healthy body fat percentage, getting enough sleep, and ensuring adequate intake of zinc, magnesium, and vitamin D. Avoiding chronic stress is crucial, as high cortisol levels suppress testosterone production. For some men, medically supervised testosterone replacement therapy, TRT, may be appropriate, but it should be considered carefully, balancing potential benefits with risks. Martin, 64, came to me feeling exhausted, irritable, and uninterested in sex. His blood work revealed borderline low testosterone. We optimized his diet with more protein, added twice-weekly weight training, and improved his sleep schedule. Within 3 months, his energy and libido returned without needing hormone therapy. Men often underestimate how much flexibility impacts sexual performance. Tight hip flexors, hamstrings, and lower back muscles can limit movement during intimacy and increase discomfort or fatigue. Over time, this stiffness can make certain positions less enjoyable or even impossible. Gentle daily stretching, yoga, or mobility drills can restore range of motion, making intimacy more comfortable and enjoyable. Focus on stretches for the hips, thighs, lower back, and pelvic area. Dennis, 71, avoided certain positions because of hip discomfort, which frustrated both him and his partner. We introduced a 10-minute evening stretch routine, focusing on the hips and lower back. After 2 months, he could comfortably return to positions he hadn't enjoyed in years, reigniting intimacy in his marriage. While no supplement is a magic pill, certain natural compounds can support sexual function. L-citrulline and L-arginine help increase nitric oxide, improving blood flow. Ginseng may enhance sexual performance and energy levels. Maca root is known for its libido-boosting effects, and ashwagandha can help reduce stress while supporting testosterone. It's important to use supplements from reputable sources and consult with a healthcare provider to avoid interactions with medications. Paul, 65, wanted a natural boost without prescription drugs. After reviewing his health, we added a combination of L-citrulline and ashwagandha. Within 6 weeks, he reported stronger morning erections and less anxiety about performance. Dehydration affects more than just energy levels. It can directly impair circulation and make erections less reliable. Water is essential for blood volume and nutrient transport, but many men over 60 drink less than they should. Aim for steady hydration throughout the day and consider adding electrolyte-rich fluids, especially in hot climates or after exercise. Electrolytes, sodium, potassium, magnesium, help maintain proper muscle and nerve function, both of which are essential for sexual performance. Harold, 67, noticed that on some days, his erections were much weaker, even though nothing else had changed. We realized he drank almost no water during busy days. By simply adding 2 bottles of water and a daily electrolyte drink, his performance became consistent again. Sexual stamina is not just about lasting longer, it's about maintaining energy, control, and enjoyment for both partners. Techniques like the start-stop method, pelvic floor strengthening, and controlled breathing can all help improve endurance. Cardio fitness also plays a role. A strong cardiovascular system means you won't get winded as quickly, keeping you present and engaged during intimacy. Victor, 62, loved intimacy, but found himself climaxing sooner than he wanted. We combined the start-stop method with daily pelvic floor exercises and short bursts of cardio training. Within 8 weeks, he could control his timing, making intimacy more fulfilling for both him and his partner. I'm Dr. Caroline Ruth, and this is Shades of Health. I hope we've delivered some great information for you today. If you found value in this, make sure to subscribe, give this video a thumbs up, and share it with someone who needs to hear it. Until next time, stay healthy, stay strong, and take care of yourself.